Hi, my name is Theo Jones of the Weekend White Coat team, and you're getting this video because we have a planned iron transfusion coming. Let's talk about it. Now, tomorrow, typically before the appointment, what I like to do is I like to get iron studies. So the day before, I have a TIA come in, or another one of the phlebotomy team members. They'll come in, they'll draw your blood. So typically what I get is your CBC, ferritin, TIBC, and just general peripheral smear, just to kind of check in and see what your iron looks like, see what your hemoglobin looks like, and see what kind of work we really need to get done. After that, when I show up for your visit, we go over everything together. So we look at the labs, we talk about your needs and what your potential future needs may be. Perfect iron supplementation, plus combination iron transfusion. It usually does the trick. Typically before I start these transfusions, we talk about your allergy history, your risk, and if there is a high upside of you having some kind of allergic reaction or just any other kind of reaction, I typically pre-medicate. In fact, in most of these cases, I pre-medicate as a precaution just to be better. Two of the medications that I use to pre-medicate is one, methylprednisolone, and two, Benadryl. But I know in this line of work that I work in, patients often have to go to prior engagements afterwards. So what I typically do is I'll say, take an oral antihistamine. Sometimes I recommend Zizol. Sometimes I recommend Zyrtec. And we just do the 125 milligrams of methylprednisolone. We usually put that in your IV first, do a test dose, and we move on to the full transfusion. Now, your transfusion is going to be done via IV. I'll inject the ferric gluconate. It's going to be 125 milligrams. I typically just put it right in the 500 cc saline bag. Your transfusion will typically take maybe an hour and 15 minutes, sometimes less than. Depends on how well your IV placement is and your patience with placement. After everything's done, let's talk about during the transfusion. Typically during the transfusion, the Weekend White Coat team monitors your vitals throughout. I'll hook you up to the continuous monitoring, which is just pulse ox and heart monitor while we are there, just on site, keeping an eye on you, making sure everything happens how it's supposed to happen. Sometimes transfusions have reactions with patients, which can sometimes cause flushing in the face. It can sometimes it can also cause shortness of breath, depending on what your health history may be. But rest assured, we are on site to make sure you have the best care delivery possible. Plus, we have a 24-hour guarantee. We usually extend our post-transfusion outreach to you. After the transfusion is over, we recommend staying hydrated. We also recommend, if you have other further transfusion needs, that you can book again with the Weekend White Coat team. Thank you very much.